All right, something else to talk about is, in this particular case, we started off with her arm was already, I'd already pushed her sleeve up. Sometimes your patients will have on long sleeves that you can't get pushed up. If they're thin, a lot of times you can get a accurate blood pressure by going over it. So we started off at 100/62. So I'm going to do the same thing. Find the pulse, put it on. Make sure it's nice and tight. And with her sleeve down, we'll see what kind of blood pressure we get. Again, this works, especially if they've got tight cuffs. You're not able to push that sleeve up. There's really no need to cut the sleeve unless the patient's, critical or something like that. Really no need to do that. So a lot of times we can get a decent blood pressure just by going over the sleeve. Real thick sleeves, not so much. You're going to have to get those off like on a coat or a fleece or something like that. You're probably not going to get a real accurate blood pressure, but in this case it's t-shirt material, it's fairly thin, so we should be able to get a fairly accurate blood pressure from that. See the difference in just by having the sleeve on? So in this particular case, 95/59, I'm a little concerned about that. So I'm going to check it again, see if maybe I had the cuff down too low. Slit it up, make sure the artery mark is in the right location. Make sure that's on nice and tight. Okay, sit still for me. And then we'll check again and see how that comes up. Now there's a more accurate blood pressure, matches what we had initially. So just a really good example of, if you get a weird blood pressure, check it again, make sure your equipment is correct. It's not uncommon for the patient's blood pressure to fluctuate just a little bit, but any significant fluctuations like that, you definitely want to double check, make sure that your cuff is on. And as you can see, in this case we had a sleeve on and the pressure is almost identical to what she had with the sleeve pushed up. Other times when you push the sleeve up, it may be better to leave the sleeve down, because if you push the sleeve up and you can't get enough of the sleeve up to bear the arm and you get all this wrinkling in here, then it's going to put a little extra pressure in places that it really wouldn't normally put, and it can sometimes pinch the patient. So depending upon the clothing and those kind of things, sometimes I may choose, even though I can get the sleeve up, I may choose to go ahead, since it's a nice thin shirt, to just go ahead and do a blood pressure over that. Always keep in mind, trust your patient, not the monitor. If you get a weird reading like we just did, make some adjustments, see what happens, see if that changes anything.